Hi, everybody. Welcome to Just a Mommy Minute. Today, we're going to be talking about flat spots. We're still continuing our series on babies, and we're going to discuss the flat spots. The term is plagiocephaly in scientific terms. So it may not just be a flat spot, but it could also be a misshapen head that we're going to discuss today. So when I had my daughter, she came a little bit early, like 6 weeks early, and she ended up, when she was inside me, she was stuck. So this is one of the reasons flat spots can occur. And I want to pop a picture up here of a picture of her so you can see what she looked like. This was her at about a little over a year, I think. But you can see how her forehead was really kind of pushed out and her eyes were kind of pushed in. So these are the kinds of things we're talking about with today's topic. So let's see, this is her now. So you can see her forehead, she kind of grew under her forehead a little bit. But all right, let me get these down here. So had I known what I know now, I'm going to say that, I would have probably consistently gotten her some myofascial work, cranial work when she was an infant. I was still in school. I was still in training. I didn't know about all this stuff. It was new to me. So, she's my first kid. I wasn't around babies very much. So I didn't know about the cranial work, and I didn't even really know a lot of it existed back then. So she would get some here and there, but I really needed consistent work. How this has turned out now with her as an almost 16-year-old is it has affected her spine and her feet. So she has very flat feet. So the body compensates with the shape of the head. It compensates all the way down to the feet. So had I known then what I know now, she would have gotten consistent care. So how flat spots occur? There's a couple different ways, actually several ways. The primary one is what she had when you come out and your head is already misshapen. She was, like I said, 6 weeks early. It's very common in premature babies. She was also the daughter of a chiropractor who works on one side of her table, which means that I have a tight muscle in my abdomen. So she just laid one way the whole time. I'd never really felt her move around like some moms get to enjoy that big movement. I didn't ever feel that. So she was really stuck in my belly. So that also caused the misshapen head. The second way is you don't detect it till like a month after a baby's born. This is the secondary one. And that may be due to muscle tension. So like I was talking about, she has flat feet. You can have muscle tension all the way down to your feet, but it's usually the diaphragm up that can cause pulling on the inside of the cranium that can cause your bones, the baby's bones, to look flat or misshapen or out of alignment. So what we do as chiropractors, pediatric chiropractors especially, we really work to release the muscle tension so that the cranial bones can kind of balance out again. We also work the cranial bones all around the head and neck, shoulders, abdomen. I work all the way down to the feet to find any restrictions and loosen it all up, all the way up. So sometimes there's flat spots just due to position, like the baby's always in the same position. And we can detect whether that's the case. If that's the case, that the child's going to grow out of that once they start to gain more head control and sitting. But if there is muscle tension, then that needs to be corrected as an infant, or it will lead to other issues as they grow older. The best time to get these things corrected is before growth spurts. Some of the patients I see that are probably watching this will notice that when their child has gone through a growth spurt, things kind of pull back down again. So we have to kind of loosen the muscles up again. So a couple things you can do, actually several things at home if your child has a flat spot. When you're changing your baby on the changing table, lay their head at one end for one diaper change and then with you on the side. So that they're going to turn and look at you. The next diaper change, lay their head at the other end, so they're going to look at you. Then another thing you can do is the crib, or where they sleep. Unless they're sleeping next to you, this won't work. But change the sides of the bed that they sleep to, okay? When they're in their strollers, put their toys to the side, so they have to turn their head to look at their toys. Alternate the sides when you carry them. So some babies will only want to look a certain way. Do it the other way, where they look the other way. Now, some babies may get a little fussy when you do that because they don't want to turn their head that way, but that's going to also help kind of balance the muscles. And my all-time favorite, tummy time. Again, tummy time is great for this. Get down there, play with the baby. So if your baby wants to constantly look to the right, play to the left and interact on that left side. Again, if your baby hates tummy time, a small pillow just to prop up the shoulders, get their head up, that will help. They'll eventually get used to it and like it. So I hope you enjoyed the tips on how to resolve a flat spot. If you do see a flat spot or misshapen head or anything like that, look at the eyes too. If one's larger, one's smaller, there could be a shift there. Bring them in, we'll get them checked out and see if we can help. And I think that's it for today. I hope you all have a great Wednesday. I did it on time this week. And let's see, next week, I'm not sure our topic, but we're going to continue with the infant series for this month. So I hope you're enjoying learning about the development of infants and how to help your babies. And we'll talk to you soon. Bye.